Let me welcome you to our comprehensive look at cholecystitis and its treatment options. Today, we'll walk through both medical and surgical approaches for managing this gallbladder condition. This information comes from Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE. We'll help you understand your available choices, weigh their benefits and risks, and guide you toward making an informed decision about your care. Let's explore this common but significant health challenge together. Let's start with understanding cholecystitis, the inflammation of your gallbladder. Think of your gallbladder as a small, pear-shaped organ tucked beneath your liver, storing bile for fat digestion. When gallstones block the gallbladder's duct, inflammation develops, causing significant discomfort and disrupting your normal digestive processes. This understanding forms the foundation for exploring your treatment options. You'll want to watch for several key warning signs. The most noticeable symptom is intense pain in your upper right or mid-upper abdomen, often spreading to your back or shoulder. This pain typically gets worse after eating heavy or fatty meals. You might also experience fever and chills, especially in acute cases, and jaundice, where your skin and eyes take on a yellowish tint, suggesting a bile duct blockage. Nausea, vomiting, indigestion, and tenderness in the upper right abdomen are other common signs. If these symptoms sound familiar, please seek medical help right away. There's an important distinction between acute and chronic cholecystitis. Acute cases hit suddenly with severe pain when gallstones block the gallbladder duct. These need immediate medical attention. Chronic cases, on the other hand, involve milder but ongoing inflammation from repeated attacks. Here's why early treatment matters. Without proper care, cholecystitis can lead to dangerous complications like severe infections, gallbladder rupture, or pancreatitis, all potentially life-threatening conditions. When it comes to treating cholecystitis, you have two main options. The first is a conservative approach using medications and supportive care to manage symptoms and inflammation. This is often our starting point, especially for those who aren't good candidates for surgery. The second option, which offers a definitive solution, involves surgical removal of the gallbladder, addressing the root cause and preventing future problems. Let's help you understand which path might work best for you. Let's examine Path 1, medical management. This approach focuses on 5 essential goals: pain relief, reducing inflammation, controlling infection, managing symptoms like nausea and fever, and stabilizing patients who might need surgery later. We accomplish these goals using pain relievers like NSAIDs, anti-inflammatory medications, antibiotics when necessary, and medications to control nausea. The role of supportive care shouldn't be underestimated in managing these conditions. We typically recommend several lifestyle changes, including eating smaller, more frequent meals with less fat to reduce stress on your gallbladder. Staying well hydrated is crucial, and some patients might need IV fluids if they're vomiting frequently. Rest is important, and we advise avoiding strenuous activities during healing. Keep in mind, though, while medications can help with symptoms, they don't address the underlying cause, especially when gallstones are present. This means surgery might eventually become necessary. Looking at Path 2, surgical treatment, becomes essential when conservative methods aren't providing enough relief, particularly in cases involving gallstones or severe inflammation. This approach involves removing the inflamed gallbladder, effectively eliminating both pain and infection while preventing future attacks. It's a definitive solution that helps avoid complications while offering permanent relief from cholecystitis. Laparoscopic cholecystectomy has become our gold standard for gallbladder removal. Picture this minimally invasive approach. The surgeon makes 4 small incisions, inserting a laparoscope and specialized instruments while viewing the procedure on a high-definition monitor. This modern technique offers remarkable advantages over traditional surgery: less pain, shorter hospital stays, quicker recovery, minimal scarring, lower infection risk, and a faster return to normal eating habits. Sometimes traditional open surgery becomes necessary, and recovery times vary significantly between the two approaches. With laparoscopic surgery, you can typically return to work within 1 to 2 weeks and achieve full recovery within a month. Open surgery requires more patience, Expect 4 to 6 weeks before returning to work, and 2 to 3 months for complete recovery. We might need to use open surgery in cases of severe inflammation, complex anatomy, or if complications arise during a laparoscopic procedure. This means a larger incision, longer hospital stay, and higher risk of complications. Let's put these approaches side by side. Medical treatment offers conservative management through medications and lifestyle changes, while laparoscopic surgery provides a definitive solution by removing the gallbladder completely. Though medical treatment can manage symptoms, it doesn't address the root cause. Surgery, despite having higher upfront costs and standard surgical risks, delivers permanent relief with typically just 1 to 2 weeks of recovery time. While mild cases might respond well to medical treatment, surgery often becomes the recommended choice for severe cases, especially those involving gallstones or recurring symptoms. The choice between treatment paths depends largely on your specific situation. Medical management often works well for mild, manageable symptoms, particularly when surgery might be risky. However, surgical intervention becomes our recommended choice when symptoms are severe and persistent, especially with gallstones causing repeated attacks, recurrent cholecystitis, or complications like pancreatitis. Your personal treatment decision should take several key factors into account. We'll need to evaluate how severe your symptoms are, whether they're mild and manageable, or significantly affecting your daily activities. Your overall health and any existing conditions play a vital role in determining surgical risks. The presence of gallstones often suggests surgery might be your best long-term solution. We'll also discuss your goals, whether you're looking for temporary relief or a permanent fix, and carefully consider your comfort level with the risks and benefits of each approach. During your consultation, you'll want to ask several important questions to make informed decisions about your care. I encourage you to be proactive. Ask about the specific type of cholecystitis you have, understand all available treatment options and their implications, and clarify whether medical treatment alone might work for you. If surgery comes up as a recommendation, ask about the surgical approach, recovery expectations, and follow-up care requirements. Don't shy away from questions about possible complications and how treatment might impact your daily routine. Let me highlight the key takeaways about managing cholecystitis. While this gallbladder inflammation can initially be treated with medication, most patients find that laparoscopic cholecystectomy provides the best long-term results. Remember, you have support. Work closely with your medical team to develop a treatment plan that fits your specific situation. Finally, I need to emphasize some important legal considerations. Everything we've discussed today is for educational purposes only and shouldn't replace professional medical advice. Please consult your healthcare provider about your specific situation. For any medical emergencies, don't hesitate to contact emergency services immediately. While this presentation has been informative, it doesn't create a doctor-patient relationship. Thank you for your attention to this important topic.